Hello, it's Wednesday at noon, which means it's time for another Moments in Medicine Live. Thank you for joining us on Nebraska Medicine's Facebook page. You know, we're well into February, so I'd like to say, this is when you do the live shot and you pray for your life that you don't screw it up. We need to talk about basketball and basketball sports injuries. There's a good one. Okay, that's my disclaimer. The other disclaimer is that obviously the discussion we're having here today is to be used for informational purposes only. So if you have specific questions regarding your medical plan or your treatment, please talk with your doctor directly. Okay, I don't want to butcher the titles here. So today I'm joined by two people. We have UNMC physical therapist researcher, Dr. Liz Welsand, and a Nebraska Medicine orthopedic surgeon, Dr. Matthew Tao. Thank you both so much for joining us today.
Absolutely.
Tell us where we're at. Well, where are we here for the consumers to know?
We are in the Lauritzen Outpatient Center, so I don't know if we can do a video of kind of around here, but this is part of our physical therapy space here, and this is our outpatient center that has orthopedic surgery. We have a surgery center here. We're right at kind of 40th and LaFleur, so on campus,
Wonderful.
But separate from the main hospital, which is nice. So.
All right, and I know I told you my first question was going to be, how long have you been practicing here?
So I've been on campus here about 3 years. I'm on faculty in the physical therapy education division. So my academic space is over in Bennett Hall across the street, and then we have a biomechanics lab space just across the street from here in the Student Life Center.
Awesome.
And I've been here 2 years now.
Okay.
This is my second year.
And you're both here at the Lauritzen, and where else?
Yep, and then I have faculty office here, clinic, and OR space here, and then I also see people out at Oakview out in 44th and Center.
Wonderful. All right, so I'm going to start with you. What are the most common types of basketball injuries that you see in your patients?
Yeah, it really runs the whole gamut. I mean, I think Liz would agree. We see probably primarily lower extremity things. We certainly see some hand and wrist fractures, shoulder dislocations, that kind of thing, but probably most of them are foot and ankle, knee, hip, somewhere in that range. Just thinking back of people that I've seen recently, it's been all over the place. I mean, midfoot sprains, rolled ankles, ligament injuries to the knee, hip flexor strains, that kind of thing. And fortunately, most of those are non-operative, not things that are real serious. We just kind of pull you out for a little while, get you plugged in with our physical therapy colleagues and the trainers, and get people back. But yeah, we do see a whole spectrum of things. So.
All right. And what about you? What's the? I'm going to throw a curveball at you. Pardon the pun, this is the wrong sport. What is the youngest patient that you've ever had to do treatment on, and what's the oldest?
Yeah, so the age range of these injuries can really vary. You see kids in elementary school, and then you see people all the way up into their middle ages who might be weekend warriors and different things. And I think from a recovery standpoint, we really think about individualizing our treatment dependent on the patient goals, and those goals can be a lot different because these injuries cross such a wide range and different competitive levels. You know, a kid who's a high school junior might have immediate goals of trying to get back to return to their team to finish out the season, or if it's a major injury, they might be worried about how that's going to impact their ability to play basketball as a senior in high school. That might look a lot different from the weekend warrior who might have goals just to be able to get back to work or to fulfill their home responsibilities. So from our perspective, that's really what makes treating these people fun, is because of it. Really making sure that our surgical and rehabilitation decisions are based on what the patient goals are.
Wonderful.
Yeah, I think that highlights, I mean, why basketball is such a fun sport, because it can be from little kids all the way up through adulthood. And I mean, absolutely right. I get the level of competition can be anything from just dribbling in the driveway up through, elite college and pro teams. So it is part of the fun of basketball.
I will say, once you get to a certain age range, the half court is probably the better. Full court, not so much anymore. But, so this is something I'm very interested in, because I've kind of grown up with this notion that it seems like a lot of female student athletes are having ACL injuries, and now boys get it too, absolutely. But are you seeing differences in injury patterns for things like ACL tears when we look at women versus men? And there's just follow-up. How do you approach that from a physical therapy perspective?
Yeah, so a lot of those injuries, like ACL injuries, are caused by what we call a non-contact mechanism of injury. So a person might be cutting or landing from a jump, and they injure their knee or their hip without a defender or another person even contacting them. And a large contributor to some of those injuries is the way that people move. Some movement patterns can put you at a more risky position for injury. And so with things like ACL injuries, both men and women can exhibit these risky behaviors in their movement, but women tend to have more of these movement patterns than men, so they're typically more prone to ACL injuries. But because men typically participate in more of these cutting and pivoting sports like basketball, a lot of times the number of injuries are pretty similar between men and women. So from a PT's perspective, why that matters to us is we're really focused on retraining the way a person moves during the same time that they're regaining their muscle strength or working on their range of motion, so that when they do get back to playing sport, we're making sure that they're moving in a safer way, so hopefully they don't have another injury down the road.
Great. It's alarming how young some of these injuries are taking place, though.
Yeah.
I have a son, one of my sons, whose friend's 12 years old, tore his first ACL and has done it more than once. So it's alarming a little bit. Certainly, the eyes of the general population, ACL tears are commonly associated with basketball. They seem to be constantly popping up in news stories involving high-level college pro athletes. What makes these injuries so devastating for the student athlete or the young adult?
Yeah, I mean, gosh, 12. You know, I wish that was out of the norm, but we see it. You know, and part of that's just kids love playing sports, and so there's always going to be some inherent risk in that. But one of the things I think both of us are interested in is how do we try to reduce that? And Liz is really an expert in that. But yeah, you're absolutely right. I mean, these are devastating injuries. There's no question about it. I think it spans several things: emotional, physical, just the whole outlook of the injury. You know, emotionally, gosh, we don't talk about it that much, but there's a real psychological journey that goes on with things like an ACL tear. And it almost always happens when you do something that you love, and there's ups and downs. Again, whether you're 12 years old or you're playing in the NBA, it's tough at times. There's going to be some ups and downs through that journey. And physically, there's no question. I mean, getting over the initial injury, the surgery, the rehab side of it, I think from a surgical standpoint, it's really important for us to do a good job reconstructing that knee to set you up for a good recovery. But man, that is just the beginning. I think, as Liz can tell you, that rehab process is absolutely critical for people to get back at a high level. And that really plays in the outlook. I think the outlook, more and more we realize that for a safe return to basketball, or anything, but particularly cutting, pivoting sport like basketball, it's at least 9 to 12 months. And sometimes in our high-risk kids or younger people, it's longer than that. And that's just a long time. It's hard for an athlete to stare down the barrel of, you know, a year-long recovery. But if you see, I mean, just you mentioned high-level people like Kristaps Porzingis, who was with the Knicks and recently traded the Mavericks. He injured himself a year ago this month and had surgery right away by one of my mentors in New York, who's just an unbelievable surgeon and has had obviously the best of everything, access to anything that he could want. And Mark Cuban just came out recently and said it's going to be, you know, until after the season, like it's not going to come back this season. So I will say, as a surgeon, and Liz probably agrees with this, I actually love that. Like, it tells me that the players, the organization, the physicians, they're engaged in getting him back at 100%. They're not looking at a timeline, they're really looking at a functional recovery.
Sure.
And I think that really plays into Liz's world, which is just absolutely critical to get people back, whether it's a young kid or a pro athlete. So.
And I think that's why these injuries can be so devastating, because there are some long-term consequences that aren't always on the radar of the patient or the parents, but for us, it's a huge part of what our care looks like for these people. We know that young kids who have an ACL injury and go back to playing sport, about 1/3 of them are probably going to have a second ACL injury, no different than that kid that you mentioned before. And so for us, here at UNMC Nebraska Medicine, a huge part for us is making sure that we're putting that into practice. And so something we do is some return to sport testing to make sure that patients are fully recovered before they're going back. So we do some very high level strength testing, and then we take advantage of our biomechanics lab across the street to be able to measure how people are moving in ways that you can't see with your naked eye, so that we are sure that an athlete is as recovered as possible, and hopefully moving in a way that makes them as safe as possible to go back, so we can try to decrease all of those additional re-injuries after the first. So.
Well, before I get to the next question, because that's a hot one for me, I can't wait to ask you guys this. I do want to remind viewers that you are able to ask your own questions in the comments section. And as those arise, I'm going to defer to my varsity teammate, Taylor, master videographer. He will let us know if there are questions that come in. So, okay, the hot question that I wanted to tell you, or ask you. I know that when I was growing up, which was many years ago, you know, the amount of kids that only had the one sport on their repertoire of like what they did was very limited. And many times it had to do with maybe, you know, financial means. There are certainly some sports that are much more expensive to participate in. And I would say basketball is one of those that, you know, other than, well, depending on set of sneakers, I guess, that's the one variable, but you don't have a lot of excess equipment. So I see a lot of kids playing basketball versus some of the more special, like hockey and baseball, with lots of loaded equipment. That being said, I grew up with a handful of friends, and I was one of them who played 3-4 sports because that's just was the norm. Nowadays, and I mean, it's not been that far removed, so many of my children's friends are single sport focused, and I refuse to do it because I've read so much on the overuse of injury, the increase of burnout, and I just wanted to know if you could address some of that. You know, what are your views on the single sport specialization, and what conversations do you have with athletes about that?
Yeah, sports specialization is a very worthy topic because so many youth athletes are pushed to just pick one sport to try to specialize in. I think one thing that happens in sports specialization is when you're doing the same sport year round, it's not unheard of to hear of a soccer player who plays 3 months in high school and then is doing club and traveling teams the whole rest of the year, is they really don't get breaks from that sport. So they're doing the same activities and movements over and over again without those rest breaks and periods, and that really makes them more at risk for injury. It's no different than thinking about an adult who has to do a lot of heavy lifting as part of their job. They're doing that every day. They're going to be more at risk for a major back injury. And evidence shows that. We see that multi-sport athletes are at a much lower rate of having injury than single sport athletes. And I think the other thing, besides injury, what we think about is just developing their overall athletic skills. John Cook, the head coach for Nebraska volleyball, recently noted that 90% of his All-Americans were multi-sport athletes in high school, and he noted that they just come in as better overall athletes, and they pick up the volleyball skills along the way, and they're soon some of the best athletes in the country. So.
Sure.
Yeah, I mean, that's a great point about Coach Cook. I mean, I think if you look at the research, like the medical literature on this too, there's a couple articles talking about like world-class athlete Olympians in that level and how the vast majority of them were multi-sport athletes. And I think, you know, Liz is right. This is a super timely topic, Heidi. I think, gosh, the medical community in general is really interested in it. And these kids that we see that just play one sport all year round, no breaks, like it really sets you up for trouble. And I think part of it is just they're young. You know, they're still growing. It's different than an adult. So the injury profile is a little bit different. And so I think a good rule of thumb, if you look at the literature to keep these kids safe, is take 3 breaks throughout the year that are a month long each. You know, you just have to have some time away from sport, whether it's, you know, going from basketball to swimming or whatever, but taking some time away from that sport. And I mean, I really feel strongly that we as physicians, therapists, trainers kind of need a unified voice for change to help protect these kids because it is a problem and it's something that even as parents, you know, Liz and I both have young kids. Like, I think we need to evaluate what our goals are for our kids. I mean, there's no question we want them to succeed athletically, but, you know, really we don't want them to do that at the expense of their overall well-being. You know, things like basketball are so good for teamwork and socialization and skill development and work ethic and all those things. But, I mean, ultimately that should just be a springboard for you to be a well-rounded individual who interacts well in society and embraces an active lifestyle. So we've got to be a little bit careful from that perspective.
I so appreciate you saying that because from, you know, a mom of a multi-sport kids, I see certain friends, families that they might feel the pressure to, well, but if we miss summer ball and if we miss fall conditioning and if we miss all the games in the winter, we're going to get behind the 8 ball. And all I would say, this is my best advice that I give to other parents, is go out to the NCAA website and just go ahead and type in, you know, how many of our kids are actually going to excel in college. And of those, are going to play. And of those, how many go professional? And just put things into perspective that this is a chapter in their lives. And I just feel like it's very important to embrace that chapter and to support them and not burn them out. What are some of the ways for the avid basketball players that you suggest to prevent injuries?
Well, I'll let you lead that off from a movement or physical standpoint. Liz is an expert when it comes to that. So.
Yeah, I think there's 2 big ways that we can help reduce these injuries in terms of muscle strength and then the way a person moves. So muscle strength is so important through the core, hips, thighs, all around to help prevent injuries, but equally important is the way you move like we've been discussing here. There's some really nice injury prevention programs that are out there, such as the FIFA 11 Plus is one such program, but they're really meant to be completed in a group setting as part of a warm-up for practice or games. And they've been shown to be incredibly effective. They address those muscle strength and movement patterns, and some have been shown to reduce injury rates by over 50%. So they can be really effective, but they really require buy-in from the coaches, the athletes, the parents, because they have to be done routinely. If they're not done, then they're not going to be effective. So that's probably the hardest part in trying to implement those programs.
Sure.
Yeah, I think, that it's a huge thing from a physical standpoint. I think just in terms of some other kind of game smarts, one thing that probably goes without saying, but is just to stay fit, and that matters a lot. I think whether you're 15 or 50, just staying healthy obviously helps reduce your injuries on the court, but probably even more important is just your health overall, long term.
Absolutely.
Things like, especially with our middle school and high school kids, sports physicals, most of the schools require that, but that's just important to make sure your heart's healthy, that you're safe to participate in sports, and just be smart. I think if you're hurt or something's not right, we all love that story of Michael Jordan playing with the flu and dropping 38 points in the finals, but probably for the vast majority of us, that's probably not the best idea most of the time.
Sure.
So, yeah.
Well, we're sitting about 15 minutes in. Do we have any questions?
We do. We have a viewer who's asking if some of the advancements in equipment today that players wear or use have helped to decrease injury risk for players. Also, he looks forward to his Knicks drafting Zion Williamson.
Love it. Love it.
Well, as a Duke fan, I love that. So, we're hoping that Zion and RJ Barrett go 1 and 2. So, yeah, I think from the equipment standpoint, it can kind of go both directions. We see, like in college, a lot of the football linemen will wear those braces, but then you see in the pros, pretty much nobody wears them. So I think they can be helpful for some things. I don't know if Liz has comments on that, but it can certainly translate force up and down the line. I will say for basketball specifically, the shoes are sometimes challenging. Like, these shoes a lot of times do not have a lot of support. The shoe companies are really driving that. So they want them to be light. They want them to be really flexible. The downside of that is they're not really that robust and supportive. So that can be hard for kids that have foot and ankle issues, or really even knee and hip. It really propagates up that coal,
Sure.
we'd call it the kinetic chain. So I think it can go both ways.
All right, I'm going to get my prop back again. So, passing to you. You already claimed Duke Blue Devils.
Yeah.
Favorite basketball team, pass to her.
Ooh, I'm a Husker fan. I grew up going to women's basketball camps in Lincoln, and the women's team have had a pretty good team over the
and
years.
I love
so
you.
I
Because we
keep that in mind,
met and now we're fast friends. But as a Creighton alum, I bleed blue. The wrong blue team, but I
Wrong
bleed
color
blue.
blue.
And then next question, who's your favorite Metro High School basketball team?
Oh, I'm a West Side guy.
Oh, okay,
Sure.
Simons. Yeah.
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 You? You have a team? Or not?
I'm from a rural area, so I always root for the underdogs. I grew up in a C2 high school, so
Nice.
I'm always going to root for the smaller team.
I love it. I love it. All right.
Nice. All right.
And it's a tricky question for me. There's so many deserving teams out there today. I would say anybody can take the challenge and run with it.
Not
but
that
I
you're
really,
biased.
I really
Not that
do
you're
like
biased,
the
yeah.
Thunderbirds. So, all right. Well, I just want to thank you guys today. If you guys are interested, look at how approachable these two are. Knowledgeable, approachable. If you have a student athlete, if you yourself are the weekend warrior and you'd like to get seen, you can call 402-559-8000. You can also visit the Nebraska Sports Medicine provider via our website. You can find them right on our website at nebraskamed.com. Thank you for watching. Thank you two for participating. And we ask you to join us for our next Moments in Medicine Live.